mental illness is a combination of biology, psychology, and social factors. And in some cases, people would bring in spiritual factors. How can any one person do all of these? Because we cannot control so much of society, and there's only so much we can do as individual professionals.
Should I go first, Alvin?
Please do. I'm still processing in my head.
Okay. So we have a team of 2 psychiatrists, a number of counselors, and a clinical psychologist. The psychiatrists, both of us, tend to make a diagnosis and then prescribe medication. The cognitive behavioral therapy and counseling, we leave it to the counselors and the clinical psychologists to do. Clinical psychologists are trained to do CBT in this country because that's the main therapy that they are trained to do, and CBT is an evidence-based therapy. We use only evidence-based therapy in our work, at least in my work. So I do interpersonal psychotherapy when I see that the patients have an interpersonal focus, but for CBT, I refer to the clinical psychologists who are working with me. So I am all for combined effort, teamwork, doing things together in order to help patients.
I'm going to give an example of a forensic situation where a psychiatrist has been tasked to provide some kind of a diagnosis of an alleged criminal. So the psychiatrist, of course, to me, outsourced, basically, something like an outsourced agent who does the comprehensive assessment, and then it goes to the psychiatrist to help with the diagnosis, because I cannot be providing the legal diagnosis. Again, in this country, in actually most countries, isn't it, Dr. Xavier, that psychiatrists are the only person who's able to diagnose?
Actually, clinical psychologists can also diagnose, but the thing is, y'all are not covered by any act. Then the validity of your diagnosis is challenged.
That's right. Yeah.
Right?
So usually the psychiatrist is the one who would sign off on the diagnosis form or letter, but we provide the support. So that's one example of working together. And at the same time, we have someone who's an alleged criminal who's going through all these things. It's very stressful. So we also outsource to the counselor to help this person who's going through the legal process. Legal process is very stressful. If you know that the whole process is going to be tough, you try to manage as well as possible, because at the end of the day, it's group effort in providing the best emotional, mental health support to everyone. So it's about creating a system and to provide the scaffolding around the system, around a person, so that a person is able to be as stable as possible. And we need to also understand that the system includes us as individual professionals, and we need to also be very responsible for our own health, mental and physical. So each time we approach a problem as in someone refers an individual to us, the way I see it is that the problem is not that one person. The problem is basically an interaction of all kinds of factors that somehow highlights the individual as having a problem. And this is where we cannot function as a single mental health professional to solely provide the treatment.
Totally agree with Dr. Alvin. Really talking about partnership is not just limited to psychiatric, clinical psychologists, or anyone related with mental health. And another one actually is family therapists. But I do see that the value for us as a mental health profession to work very closely with GP. So that's where I also work very closely with GP, and you trust me, okay, Nicole will able to do some form of assessment to decide whether that the best case go to the clinical psychologist or a psychiatric or others expertise. So therefore, the partnership is extended to many. My perspectives has been included school. If example, I'm going to work with children, in the systemic perspective, you can't lose anyone. You have to have a structure that everyone comes together to provide support. And that's how we provide a very comprehensive support to this client, therefore she can recover and bounce back faster.